is Jocelyn.
And I'm Sean.
And we're medical students at the Alabama College of Osteopathic Medicine. And my colleagues and I today are going to discuss with you about seizures. First off, what is a seizure? A seizure is an abnormal firing of cells in the brain. It can cause a surge of activity that can cause changes in awareness, behavior, and even changes that cause abnormal movements. Having one or more of these seizures is called epilepsy.
Some signs and symptoms that you can expect. There are a variety of different symptoms with different seizures, but some of the things that you want to be looking out for are muscle stiffening and jerky movements, staring off into space, loss of consciousness, falling in confusion, and sometimes you'll also see a loss of bowel and bladder control as well as tongue bite. So what are some of the stages of seizure? An aura is kind of generalized to all seizures, but basically it's a feeling that someone will get before the seizure starts. This can range from dizziness to a change in emotions to seeing lights or hearing sounds. For each person it's different. Now specifically on the slides you'll see a tonic stage and a clonic stage. That is for a tonic-clonic seizure. So for the tonic stage what you will have is you'll have muscle stiffening, and then for the clonic stage you'll have a jerking of those movements. And afterwards, you'll have something called a post-ictal state. So the post-ictal state is essentially just the stage after the seizure, where you'll experience a multitude of different symptoms. You'll have weakness, confusion, possibly a headache, and this can last anywhere from minutes up to hours.
Here's something that you can do to possibly intervene. Number 1 is do not panic. Number 2 is to turn the person on their side and start timing the seizure. Number 3 is to stay with either the child or the patient and do not restrain them. Number 4 is place something soft underneath their head. Number 5, do not put anything in their mouth that can obstruct their airway. And number 6, call 911 if the seizure lasts longer than 5 minutes.
Hello, my name is Sarah.
My name is Noel.
So they spoke with you a little bit about signs and symptoms of a seizure. Let's talk about when to call 911 if you're suspecting a seizure. So if the person has never had a seizure in the past, if the seizure is lasting over 5 minutes, or if they're occurring one after the other. Also, if the patient is exhibiting signs of trouble with breathing or choking.
And now let's discuss some risk factors for having seizures. These can include a family history of having seizures, low blood sugar, alcohol abuse, certain medications, and also brain injury.
So seizure triggers can look different for different people, but these are some of the leading ones. So if the patient is having some strong emotions or stressful situations, intense exercise, loud music, flashing lights, fever, menstrual cycle, lack of sleep, or medication noncompliance. This is a big one because if you miss your anti-epileptic medication, this can cause you to have a seizure.
So let's discuss some of the diagnostic workup you might find whenever you have a seizure. The first is usually an EEG, or electroencephalogram, where a network of nodes are placed on your head, and a physician will then read the brain waves that they take from those sensors to find the seizure. Also, a picture of your brain might be taken through an MRI. And lastly, there's usually some blood work where they look for blood abnormalities that could indicate you have a seizure.
Let's talk a little bit about treatment now that we know how a seizure is worked up, the signs and symptoms. So there are many different types of anti-epileptic medications, and you'll speak with your physician to figure out which is the most appropriate. It's important to adhere to your medication as directed by your physician. Otherwise, this can cause you to have a breakthrough seizure. It's important to also discuss with your physician some of the side effects of these medications, as some of them can cause vitamin deficiencies and you might need supplementation. Also, it's important to consider if you're thinking about expanding your family or having children while on an anti-epileptic medication, because there are some contraindications to certain medications.
Thank you for listening, and we hope that this video has shed some light on seizures. For more information, please visit www.epilepsy.com or talk to your physician